Ravi, the year was 1991, decades before COVID, but at U of I there was a different threat, a deadly threat that killed a second Illini student within days from meningitis disease. And as fear turned to frenzy there, university officials huddled with the Centers for Disease Control to handle the health crisis, a now familiar struggle whether they should quarantine the campus, send students home, or vaccinate.
After the second student died, it became very real, and that was my second semester of my freshman year in 1991.
The world was preoccupied with Operation Desert Storm, the first Gulf War that had just launched a few weeks earlier. But here at U of I, when two students died within days of each other from meningitis infections, there would soon be a battle for health and safety on Illinois' flagship campus, beginning with antibiotics for thousands of students who may have been exposed to the highly contagious and potentially dangerous infection.
We were all just a little cautious. I would maybe even call it, the 90s version of social distancing.
Within the year, 8 students got sick and a total of 3 died. U of I was advised by the federal government to vaccinate students. 40,000 doses of Menimmune were purchased from a lab in Philadelphia for about $150,000. Dr. Bryn Schuler is a staff physician at U of I's McKinley Health Center. She was a freshman when the mass vaccinations happened during a 3-day period at the Armory.
You rolled up your sleeve and bared your arm, and they didn't have a needle like they do now. They just had the air guns. They air shot the vaccine into your arm.
It was almost surreal when we were in line to get that vaccine. I truly remember standing in the line, waiting a long time, and being very scared.
Nearly 19,000 students received the vaccine back then. Now, almost 30 years later, it is a pandemic disease that Dr. Schuler tends to, caring for COVID patients on campus, and she's hopeful with vaccines arriving this week at U of I.
Everybody who wants to get vaccinated will be up for it at that point.
The I-Team tonight told that U of I has now done more than 1 million COVID tests since July. The 7-day positivity rate is 0.2%, a small fraction of what the numbers look like in the rest of the state. The university now working with local health officials to figure out how to facilitate vaccinations on campus once they become more widely available.
Hey, if you like that video, be sure to subscribe to our ABC7 Chicago YouTube channel.